we have quite a substantial number, and we've split it between 3 institutions. So the Greater Accra Regional Hospital being one, the National Blood Service being the other, and the Princess Marie Louis Hospital being the third. And so we're just here to do the presentation of the blood to the various facility, and we look forward to its use to prevent any mortality associated with anemia or associated with hemorrhage. So if you're here, this is one of the activities that the alumni has undertaken this year. The other two that have been done already are the tech care. When we say tech care, the biomedical engineers taking care of medical equipment in various facilities within the Volta and UT regions. And we also were in Amasaman during a clinical outreach, in which on the 10th and 11th there was a medical screening, 17th and 18th there were surgeries at the West Municipal Hospital or Amasaman District Hospital. So this is the last leg, and we hope that we'll bring a finality to our activities for this year. President of the Korean Foundation for International Health, Ghana chapter called KGA, and we embark on a couple of activities for this year. We've had what we call the tech care, where our biomedical engineers and some other members of the alumni were in the OT and Volta region repairing equipment within the hospital facilities. We were also in Amasaman a couple of weeks ago for a clinical outreach in which there was medical screening and free treatment of patients, and also had free surgeries. And this is the last leg where we've encouraged Ghanaians to be donors, and so we had sites within the Greater Accra region basically. And as we speak today, the group also have a number at the Lashibi SHS helping to get blood into our blood bank. So basically, last week we were at ATTC, we had another group at WAS, and the last group was at St. Thomas Aquinas. And today what you saw here is just the giving away of the blood to the various institutions that we plan to give to. So Ridge Hospital had some, Princess Marie Louis Children's Hospital had some, and the rest was given to the National Blood Service to keep, just in case any facility, either private or public, goes to them. There will be blood available to save lives within the country. We shared it according to the patient load. So the Princess Marie Louis had around 43, Ridge had 120, and the National Blood Service had close to 150. We would encourage that, yes, we are trying to get the younger ones to donate, but every one of us who is healthy is capable of donating, because you never know when you're going to fall ill and need blood. And so I encourage the general public, especially those of us who are healthy, to be blood donors.
Blood donation is very important to our outfit, because the National Blood Service is an agency under the Ministry of Health with a mandate to procure blood and make it accessible and affordable to every hospital or clinic needing blood transfusion for their management. So as you can see, our mandate is to make sure that we get blood and save blood to save our people. So any group or organization that is into blood donation, we don't actually take it for granted. That is the reason why we are happy about the KGA coming out with a blood donation activity as part of their activity in Ghana. So we also try to lend our maximum support to make sure that the blood donation exercise is successful, so that we get quality units of blood to save lives. Yes, the Ghanaian attitude towards voluntary blood donation is changing gradually, thanks to the fact that we have engaged the Ghanaian populace in sustained education, just to make sure that at least they become aware of the need to regularly donate blood to save lives. So I can say that yes, we have some few donor groups in the country who have now embraced the concept of voluntary donation, and chiefly among them the educational institutions, for which we have the second cycle and tertiary. We have the faith-based organization also. We have corporate organizations and organized community groups coming together to make sure that at least they add blood donation as part of their activities to procure blood for management of our populace who might need blood in our hospitals. Right. So as for the religious groups, it's their religious belief, and we cannot actually falter them. We need to respect that belief, but we need to drum home the importance of blood in saving lives. So that is the reason why I always say that people should consider blood donation as safe, simple, and saves lives. You only have to be a healthy individual between the ages of 17 years to 60 years, weigh 50 kilograms, must pass an HB, and you go through some few medical tests, and you'll be able to donate a unit of blood to save a life. And mind you, The blood that you donate could save about 3 people's lives, depending on the condition that they actually face with regard to blood need. So people shouldn't see blood donation as just a mere exercise, but they should see it as an important exercise that is geared towards making sure that they contribute directly to the health of the nation. Our target every year is to procure about 322,000 units of blood per annum. That is our target, and it should come from voluntary sources. But if you ask me whether we've been able to achieve that, my answer will be no. We've not been able to achieve our target. Tried as we could, we always get around 50% of that, and even of that, we only have about 75% of that coming from family replacement donors, and the rest 30 is from voluntary unpaid sources. That is to say that we have a long way to go when it comes to getting voluntary blood donations in the country.